Welcome back to What's the Buzz in Western New York. Are you suffering from back and neck pain? Pain in your joints, arms, or legs? Have you ever thought about getting help from a chiropractor? The expert team at Western New York Spine and Sport Chiropractic are there to help.
We're here at the Western New York Spine and Sport Chiropractic. We're about to meet two brothers, two doctors who are chiropractors. This is Zach.
Hi, good morning, welcome.
Good to meet you.
Nice to
I'm
meet
Kim.
you too.
Thank you so much for having us here.
Thank you for being here.
And your brother is Dr. Tim.
Yes.
And you both attended, of course, school locally. We're a Western New York business
Born and
with
raised.
hometown family. Tell us about your background as well as Dr. Tim's background.
Yes, both of our backgrounds are based in sports medicine. We got our undergrad degrees from Canisius College in athletic training and sports medicine. And then we both decided to go on, further our knowledge and learning at New York Chiropractic College, where we both attained a Doctor of Chiropractic as well as a master's degree in clinical nutrition.
So you're really very well-rounded about an individual's health and well-being.
Yes.
Can you give us a definition of a better understanding of what is chiropractic care?
Well, chiropractic care is a very hands-on, it's very conservative. It deals with the musculoskeletal system as it pertains to muscle, ligament, nerve, bone, alignment, function, overall function really of the joint system.
General well-being.
Yes, yes.
Well, I am anxious to meet Dr. Tim, your brother, and I understand that he's working in one of your patient rooms, so I will follow you.
All right, we'll lead the way.
Here we are with Dr. Tim. Hello, Dr. Tim. You're right in the thick of it. What type of sports injuries do you treat here?
Well, we treat sprains, strains, overuse type injuries, muscle imbalances. We do functional analysis with our athletes.
And with your athletes, can I be a name dropper? Because I saw pictures on the wall. You work with the Buffalo Bills, don't you?
Yes, I do work with professional athletes. So.
That's really exciting.
Yes.
And the interaction between the doctor and the patient, what's your approach to that?
Well, we like to be very hands-on. I like to explain everything to the patient before we do it. We want them to be informed as to what's going on, as well as an active partner in their own healing process, in their own health. If you don't have the patient on board, you're fighting the patient instead of working with them and for them.
Right. And how does age affect the treatment that Dr. Tim and Dr. Zach offer?
We can adapt most of the techniques we use with our athletes to our general population patients of all ages. And it's exciting because we see some very good results.
So you're adapting what you're doing based on the age of the patient, and of course always the need of the patient.
Yes, definitely. Everything's very individualized. We're targeting the problem. It's not a generalized approach. It's a very focal approach. Everybody walks in with something different, so that's what we're going to target, their individual needs.
Dr. Zach, do we get to see you in action as well?
Yes. Yeah, we'll hop next door, and I have a patient. We're going to demonstrate some flexion distraction technique.
Flexion distraction technique.
Yes. So we're going to adjust to his height so we can get adequate traction. Dr.
Zach, what type of injury are you treating?
This would be primarily for a disc injury, any kind of disc irritation, herniation. What we're trying to do is we're trying to decompress the disc to allow it to heal. Discs also heal by way of osmosis, so the flexing and distracting of the spine and the disc itself flushes out any kind of debris and inflammatory mediators, and also brings in nutrition for the disc to heal.
Wow.
It's a simple technique with kind of powerful healing potential.
And with this type of therapy for the discs and your patients' backs, I would think that it could lead to avoiding more invasive procedures?
Yes, yeah, that's always the goal. So what we're going to do here is I'm going to place, we're feeling for disc level. So we find the level that's problematic. I'm going to slide my hand onto the bony anatomy at that level. And we're going to flex the table down, opening up that individual disc space. Now let me know, Jerry, when you start to feel that tighten up a little bit.
Okay.
Good there? Okay.
Fine.
Okay. So we're going to move until we start to feel that tighten up under with my hand, and then really all we're going to do is oscillate gently. The body's an amazing thing. The body has a lot of healing potential. We're just helping it helping it along on its way.
Did I hear you say that this technique can be used instead of traction?
Yes, it's a very comparable technique to a spinal decompression.
And so this leads back to what we said when we first came in, that overall well-being that chiropractic really aims for.
Yes, definitely. So that is what a flexion distraction
Wow.
treatment looks like.
Dr. Tim,
How
so
are ya?
we had the opportunity to see you working with a patient, and
Yes.
now you're going to take us down to see Dr. Zach, your brother.
All right.
I will follow you.
Okay, sounds good.
And so Dr. Zach is doing an adjustment.
Yes. Basically what he's doing beforehand, he assesses for the range of motion within the joints. If he finds a joint that's not moving the way it should, that's restricted in motion, he finds that segment and he'll focus on that segment. Right now he's doing a supine adjustment for the thoracic spine. And what he's doing is just restoring motion to that joint.
Wow, that's amazing. Really, really impressive, Dr. Zach. Really impressive, Dr. Tim. I love it. Hometown boys, Western New York boys who grew up here, your families are here, went to school in New York, and opened a hometown business. Thanks for having us.
Thank you.
Connect with Western New York Spine and Sport Chiropractic. They're within Transit Commons at 2701 Transit Road, Suite 138 in Elma, New York. Give them a call to set up an appointment at 675-5550. That's 675-5550. Or find out more online at WNYSSchiro.com. Stay with us. There's more What's the Buzz to come.